As an aspiring nurse, passing the NCLEX is, of course, a crucial milestone in your career. The anticipation of waiting for the results can be nerve-wracking, leading to countless hours of hair pulling and second guessing. Over time, nursing students have identified some signs that may hint, notice I said hint, at whether they passed or not. So let's go ahead and dive right in with the 5 signs that you pass the NCLEX. The first one is increasing difficulty of questions before the test is done. So as I've previously discussed in other videos, the NCLEX uses a computer adaptive testing, so CAT format, which adjusts the difficulty of questions based on your performance. So in short, as you answer questions correctly, the questions get harder. As you answer questions incorrectly, the questions get easier until essentially the computer makes the determination that you passed. For the full details of how the NCLEX is scored, make sure you check out our video that's related specifically to that. If you notice that the question is becoming more challenging as the test progresses and you got a really tough question right before it ends, that this could be a sign of a successful NCLEX attempt. I think it's important to note that this is by no means foolproof, because when it comes to difficulty of questions, is very much like an individual perceptions. So for example, you might be somebody who finds questions on OB easy and somebody else would find questions on OB difficult. And so it's very easily that one question that would be easy for you would then end up being difficult for somebody else. I think you can kind of guess what I mean from there. The next one is getting a positive Pearson Vue quick results. So in some states, Pearson Vue provides an option to purchase unofficial results 2 days after taking the exam. This is generally in most US states and territories, and I believe it excludes Canada and Australia. While the additional cost and waiting time may not be ideal, a passing result on a quick result is a strong indication of success. But with that said, it's important to remember that the quick results are not official, which means that you can't go out and, of course, start practicing as a nurse until the actual official results come in. The third is a successful Pearson Vue trick attempt. So the Pearson Vue trick is an unofficial method used by nursing students to gauge the NCLEX results. This trick involves trying to re-register for the NCLEX exam. If the system prevents you from registering, it could mean that you passed the test. And if it lets you register, then of course that means that you probably didn't pass. While some students over the years have claimed that it's pretty reliable, is not 100% accurate, as I have seen some stuff online about nursing students who were then charged doing this trick and then come to find out that they actually did pass the NCLEX. The fourth is having high confidence and adequate preparation entering the exam. So this is for the students who are really good at being able to just gauge on how well they're prepared for exam. This is generally not for students who have high test anxiety and are generally going to think that they did poorly regardless of how prepared they actually are. One of the things to note is that since about 85% of students taking the NCLEX will actually pass, your confidence level can be a pretty reliable way to gauge how well you did. The fifth point is having a strong performance on an NCLEX predictor test. So many NCLEX prep courses include predictor exams designed to estimate your performance on the actual test. These exams are typically comprehensive, and a lot of them can actually be more challenging than the NCLEX itself. From my experience and from the experience of many nursing students, scoring well on predictor tests is usually a good indication of your likelihood of passing the NCLEX. One thing to note is that while the predictor exams can be a valuable tool, they should not be the sole basis of your confidence in passing. You need to continue to study, review, and prepare for the exam as you normally would, regardless of your predictor test performance. Now that I've covered this material on the signs that you passed the NCLEX, you might want to check out some of our other videos that goes over what to do after passing the NCLEX or what to do after failing the NCLEX.